Well, it is open enrollment season when people need to carefully choose their health care plans. Choosing the best insurance for you and your family has never been more important. Joining us is Tiffany Aliche, financial educator and author known as the Budgetnista. Good morning.
Hi, Tracy.
It's great to talk with you. Okay, are people taking it more seriously than they have in years past?
Absolutely. The 2020 AFLEC Workforces Report, available at AFLEC.com, found that the pandemic has really served as a wake-up call. Over half of the folks that they interviewed said that. Myself, my husband, and I actually felt the same way. We actually just took out our policy to make sure that we're adequately covered. So people are taking it more seriously now.
I'm assuming you're not pro-pandemic. I don't know anyone who is, but I'm guessing, based on your career in education, people are finally taking it as seriously as you would have liked them to take it before the pandemic.
Yes, because if you don't have comprehensive healthcare benefit coverage and you get sick, that means your hospital bills, your doctor bills, they really can devastate a family's finances. So you want to make sure that you choose a plan that's going to help you to focus on getting better, not just your bills.
Well, and yeah, not just your bills, but also your financial health could be in jeopardy too. These things, these problems that are happening, it's just not COVID and recovering. We're talking potential long-term impact to our health, which could then have long-term impact on our finances, right?
Absolutely. Because here's the thing, Tracy. So I've seen this with the people that I've helped as well. And in the AFLEC survey, they found that 48% of folks have said, honestly, I don't have up to $1,000 to spend on out-of-pocket expenses. So if I were to get sick or there's some sort of injury, what would I do? They would lean into debt or they would lean into credit. That's why nothing is more important now for an employee than to consider their benefits and benefit enrollment. You want to look at things, not just your healthcare insurance, but also supplemental insurance, things that are going to cover accident, critical illness, hospital plans, because there are some costs that you don't anticipate until you need them that are not covered by your healthcare insurance, something like groceries or your co-pays or your rent or even gas.
That makes a lot of sense. Okay, so we know we need to be taking it seriously. We need to be studying, almost like we're back in school for this sort of thing, so we make the right decision. Any other interesting findings that popped out at you in this report?
Yes, an interesting finding that came out of the AFLEC survey is that folks are really feeling anxious. Up to 50% of folks are feeling anxious because they're worried about the cost of healthcare, so much so that people have actually delayed 46% of folks have delayed medical care because of that fear of not being able to afford, what that bill might be. I know people that are more worried about the doctor bill than their actual symptoms.
Wow. Okay. I know that this is something near and dear to your heart. You helped pass some legislation last year in New Jersey about financial education. Is that pretty much your number one tip? We really need to educate ourselves?
My number one tip is to take action. Take action, ask questions, go to HR. If you want to learn more about the AFLEC Workforces Report and supplemental insurance, go to AFLEC.com. Don't wait, take action.
We will do exactly that. We'll take the action by putting that link, AFLEC.com, on our website, IndyStyle.tv. Great advice, great perspective, great to talk to you today. Thank you so much.
Thank you, Tracy.
Appreciate it.